Circulation Part 4, Blood Creation and Clot. Erythropoiesis is the creation of red blood cells. This is a negative feedback, and it can be stimulated by multiple things: a decrease in your red blood cell count, a decrease in available oxygen, or an increase from your tissues demanding more oxygen. If any of these three things occur, our kidneys release erythropoietin. It is a chemical that stimulates your red bone marrow to create red blood cells, or erythropoiesis. Once this has created more red blood cells, we go back to the normal blood oxygen level. Up until the age of 5, almost all of your bones will actually create red blood cells. After the age of 25, your tibia and femur actually are less important in erythropoiesis. And after the age of 25, we tend to have 5 bones that create your red blood cells: the vertebrae, the sternum, the pelvis, the ribs, and the cranial bones. Blood doping. Many athletes inject themselves with erythropoietin. Remember, this is the chemical that increases erythropoiesis, or the creation of red blood cells. Now, why would they want to do that? Well, with more red blood cells, we can have more oxygen getting to the body. Therefore, the tissues will work better and work quicker. This is known as blood doping. Hemostasis, talking about clotting. A blood clot forms when we have a tear or a rip in a blood vessel. We need 4 main components to actually create a blood clot: clotting factor, platelets, fibrin, and red blood cells. Let's watch a quick video that gives you the steps and actually shows you how a blood clot forms. Now, you will need to take notes as you watch this video.
Usually, every time you have a cut or bruise, your blood clots to stop the bleeding. Clotting is a complex process, and there are 4 main things that make it possible: platelets, or cell fragments; clotting factors, which are special proteins; fibrin, which is a protein mesh made up of a special kind of clotting factor; and finally, other cells, like red and white blood cells. Because clot formation is so important, platelets and clotting factors are always available, floating around in your blood. Now, let's talk about the 4 steps involved with forming a blood clot. When there is a tear in a blood vessel, the first thing that happens is that the nearby platelets are activated and become sticky. They start sticking to each other and to the sides of the hole in the blood vessel. For small holes, enough platelets usually stick together to form a temporary plug. But a platelet plug isn't strong enough to block the opening for long, so it must be reinforced with other materials. Otherwise, the blood flowing past the hole could wash the plug away. These other materials are called clotting factors. As the clotting factors float by the tear, they become activated or turned on and add themselves to the platelet plug. A special kind of clotting factor can weave itself together with others of the same kind and form a web of fibrous tissue, called fibrin. This web acts like glue and holds the platelets and the other clotting factors together, creating a blood clot. Other cells, like red and white blood cells, can also get caught in this web and help reinforce the clot. It quickly becomes stronger and starts to pull the edges of the hole in the blood vessel together. After the clot has formed, it stays in the hole until the tissue is repaired. When the clot is no longer needed, your body dissolves it.
Now, looking at it more in detail, so we have an injury to the blood vessel, and we have our platelets and other factors come in and bind to that tear. Once that tear has that bound platelets and tissue factors, we have prothrombin activated. Well, prothrombin then activates thrombin. Thrombin in turn activates fibrinogen. Fibrinogen then turns into fibrin, which is the glue that holds that clot to that broken area and allows it to regenerate. Again, we have platelets and tissue cells activate prothrombin. Prothrombin then activates thrombin. Thrombin in turn activates fibrinogen to turn into fibrin. This occurs in about 3 to 6 minutes, depending on your vitamin K and your iron level. The clot will remain until your body has regenerated and you no longer need it, and then your body will degrade it. Helping hand. Sometimes you have such a large area and parts of the tissue have died out. Well, maggots aid in clotting and healing process because they eat that necrotic tissue and allow for accelerated healing or formation of accelerated new tissue. Now let's check out anticoagulation, what keeps us from forming undesirable clots.
Just as your body has clotting factors that help form clots, there are also anti-clotting factors in your blood that prevent clots. These are called anticoagulants. The purpose of anticoagulants is to stop clots from forming when your body doesn't need them. But since both of these factors are floating in your blood, how does your body know when a clot needs to be formed? Normally, there are more anticoagulants in your blood than activated clotting factors. And unless a blood vessel is damaged, clots don't form. But if this balance is disturbed in either direction, it can be harmful. Too many anticoagulants make it hard for your body to form clots even when they're really needed. And not enough anticoagulants may cause you to form unwanted clots. Another thing that helps your body keep this balance is that blood is always flowing, which naturally mixes up the clotting and anti-clotting factors and keeps them both from getting too concentrated in one place. When blood is not flowing smoothly, like when fatty plaques build up in your arteries, platelets and clotting factors can collect in pools and become activated. This can cause a clot to form even when the blood vessel isn't damaged.
If clots do occur, some stationary clots formed in the unbroken blood vessels are known as thrombus. And this can be deadly depending on where it forms. If it forms in the heart and it stops blood from flow to the heart, or if it forms in the brain. An embolus is a clot or is a piece of a thrombus that has broken away and moves throughout our bloodstream or blood vessels, and then can cause a clot or clog in other places. Let's watch a video to check out these.
Unwanted blood clots can be very dangerous if they float through the bloodstream. A freely floating clot can get stuck in a blood vessel, blocking it off so that blood can't get to the cells in that area. If the cells go without oxygen and nutrients for too long, they will die. An example of this is when a blood clot travels to the brain. It blocks off a blood vessel there. If blood flow is blocked off for a long time, it causes a stroke. The brain tissue that no longer gets blood from this vessel quickly dies. As you may know, a stroke can cause serious damage to the brain and even death. Clots that form in the veins of the legs can later break off and block blood vessels in the lungs. This is called a pulmonary embolism, and it can lead to shortness of breath, more serious problems, or even death. Other places that clots may become lodged include the vessels that lead to the kidneys, gastrointestinal tract, liver, or spleen. If a clot blocks off the blood supply to these organs or any other organ in your body, it can be very serious and possibly fatal. To decrease the risk of these types of problems, it's important to prevent unwanted blood clots from forming.
Here are your review questions that you need to have answered for your open notes quiz. That's all I've got for you today. Bye!